VMT study of medical research productivity with physiological inputs, and health resilience number, 1282, VMT Sharp 656, March 25, 2025. Gerald C. EclaireMD Foundation. Category, Research Productivity. Abstract. This study applies the Viscoplastic Medicine Theory, VMT energy model to explore the relationship between the author's medical research productivity and his physiological health. From 2018 to 2025, the author produced 1,280 single-authored medical papers, averaging 170 annually, despite reversing chronic conditions including type 2 diabetes, cardiovascular disease, and diabetic complications. 4 inputs: fasting plasma glucose (FPG), sleep hours, daily, walking steps, and visceral fat percentage (VF%), were selected and analyzed. Using his collected 15-year, 4 million data point dataset, the VMT energy model quantified pathophysiological stress, revealing energy contributions of FPG 28.2%, steps 25.8%, VF% 24.8%, and sleep 21.3%. These findings demonstrate how metabolic stability, physical endurance, and restorative sleep collectively sustain cognitive performance at age 78. They validate the effectiveness of the GH method in reducing chronic disease risk, promoting longevity, and enabling the author's sustained daily medical research work. Introduction. The author utilizes this study to examine the interplay between his research, productivity, and health resilience. Since publishing his first medical paper on December 5, 2017, at the International Diabetes Forum IDF in Abu Dhabi, he has authored 1,281 single-authored papers from January 1, 2018 to May 24, 2025, averaging one paper every 2 days. This rare productivity, spanning medicine, mathematics, physics, engineering, and artificial intelligence, reflects exceptional physical durability, emotional persistence, and cognitive vitality. Each medical research paper requires subject selection, structural design, data extraction, analytical modeling, using VMT, NNM, GH method, and statistical tools, scientific writing, and figure generation. Sustaining this pace for 8 years demands determination, metabolic stability, low inflammation, strong brain function, and physiological recovery, supported by a self-developed medical AI system for his health data analysis and feedback. Remarkably, the author reversed multiple chronic conditions: type 2 diabetes, cardiovascular disease, chronic kidney disease, diabetic neuropathy, and retinopathy, achieving superior glucose regulation, cardiovascular, and renal health, as confirmed by his biomarker trends. This output manifests physical resilience, high energy, endurance, and disease-free function, emotional consistency, sustained motivation and stress tolerance, cognitive sharpness, strong memory, clarity, and multidisciplinary problem solving, methodological efficiency, a mature analytical system accelerating discovery. At age 78, the author's case validates the GH method, a mathematically structured self-care approach that reduces chronic disease risk, slows aging, and extends lifespan and productivity. Selecting VMT output strain and input stresses. This study uses the author's annual research paper count as the output strain in the VMT energy model, reflecting cognitive output, physical endurance, emotional stability, and systemic resilience. With 1,281 papers over 7.5 years and a nonlinear upward trend, despite aging, this measure benchmarks long-term brain and body performance under intellectual pressure. 4 inputs were selected from a 15-year, 4 million data point dataset, based on their physiological relevance and impact on productivity. 1. Fasting plasma glucose (FPG), a marker of metabolic efficiency and cerebral energy supply, linked to clear thinking and focus. Optimized FPG reflects the author's diabetes reversal. 2. Sleep hours, essential for memory consolidation, executive function, and emotional regulation, with consistent sleep greater than 7 hours correlating with productivity. 3. Daily walking steps, a proxy for cardiovascular and physical endurance, averaging 14,000 steps daily, double the average, supporting vitality and cognitive stability. 4. Visceral fat percentage (VF%), a systemic stress marker, tied to inflammation and organ health, with reductions aligning with improved biomarkers and productivity. These 4 inputs represent overall metabolic stability, restorative capacity, physical strength, and inflammatory control, influencing cognitive function and his research output. The VMT model shows declining internal stress correlates with increasing paper production at age 78, uncovering viscoplastic energy distribution and contribution ratios. Methodology, data source and normalization. This study analyzes 9 annual datasets Y17 Y25, each corresponding to a period of biomedical research productivity. 4 inputs are normalized. VF% 13%, FPG 90 mg per deciliter. Daily walking steps 15,000 steps. Sleep hours 7.0 hours per night. Strain, input, stress, and VMT energy calculation. Strain is the progression of written medical papers. Y17 Y25, capturing evolving physiological states. Inputs are time-varying deviations from normalized baselines. Stress is calculated as the product of input, deviation and strain rate time-dependent change. VMT energy, the integral of strain, multiplied by stress over 9 years, represents the accumulated health burden. This treats biomarkers and lifestyle inputs as forces acting on a pathophysiological structure, generating measurable viscoplastic energy. Data from 2017 serve as initial conditions, contributing minimally to VMT energy as a baseline. Visualization. The VMT energy diagram plots inputs across 9 paper-defined intervals 9 years, with light yellow color shaded areas approximating cumulative energy per category, enabling comparison of 4 biomarker and lifestyle-induced stress. Results: VMT energy contribution by input. Based on the VMT energy diagram's area analysis, 4 individual energy contributions are: FPG, 28.2%, steps, 25.8%, VF%, 24.8%, sleep, 21.3%. These ratios reflect the proportional chronic burden of each factor. Correlation analysis. Pearson correlations between inputs and paper intervals are: VF%, -55%, FPG, -89%, steps, -78%, sleep, 61%. FPG's high correlation -89% aligns with its dominant VMT energy contribution 28.2%, indicating its significant influence. VF% and steps declined, while sleep improved, with FPG maintaining strong impact due to its amplitude. Discussion. The VMT energy model provides a physics-based framework for analyzing chronic disease and health, integrating temporal change and input amplitude beyond correlation-based models. FPG levels and walking steps dominate, reflecting glucose control and physical movement's critical role in sustaining the author's continuous 13-hour daily research over 15.5 years. Improved sleep and reduced VF% lower the energy burden but have less impact. This VMT model highlights how optimized biomarkers and lifestyle inputs support his high intellectual output. Conclusion. This study successfully applies the VMT energy model to quantify the cumulative burden of biomarkers and lifestyle inputs on the author's high research productivity. By tracking his physiological stress, it supports precision monitoring of disease, risk and prioritization of health interventions, advancing medical research and preventive strategies.